Hi, I'm Austin Atwell, and this is my presentation on the nursing home Vi at Highlands Ranch for HCA 448 at Colorado Christian University. So the types of care provided by Vi are independent living, assisted living, and memory support. They all have nursing staff that are available for them at all times. So what certifications do they have? They've got Medicare certification. They don't have Medicaid certification because Medicaid does not cover nursing home care unless rehabilitation is shown and ends when rehabilitation ends. So Vi is a very top end nursing home, and they don't just deal with rehabilitation. They have state certification, as all nursing homes in Colorado require, and they've never had any problems with that. They also have 24 certified beds. So, staffing. Background checks ensure staff have no history of neglect or mistreatment. They have 22 residents per day, so they've got 2 open beds. Licensed nursing staff are able to spend 6 hours and 22 minutes a day with each resident, and registered nursing staff are able to spend 2 hours and 44 minutes a day with each resident, which adds up to about 8 hours a day, which is both of those for the licensed nursing staff, that's about double the average, and for the registered nursing staff, that's over 3 times the average. So that's really good. Staff and residents. Staff are courteous to residents and know all of their names. Staff made sure that residents were happy and comfortable while I was there. Staff provided residents with snacks and drinks when needed, and no resident was left unattended for more than 20 minutes at a time, especially while eating and drinking. Stuff like that. Staff were very attentive to the residents, and the residents seemed very happy. The amenities. All the furniture is comfortable and stable. There's a full cafeteria with choices for food changing each week. Residents can decorate their own room with whatever furniture, decorations. They've got closets and storage. It's a very good place for the residents. There's a full nursing staff and care professionals to help create health plans whenever needed. So if residents think that they're not feeling so good or want a new health plan, they're always able to talk with family and staff for those health plans. And residents vote on activities to keep them happy and healthy. So they're always doing what they want to do as a collective together. Medical choices. So residents can choose whichever doctor they'd like to see. There's no set hospital for Vi. And they can also, just like I was saying before, they have a say with their health plan. So they're not locked into anything. Long-term residents of Vi with dementia are never treated with antipsychotic medication, and only 6% of short-term patients have been treated with antipsychotic medication. So it's a really low value for that. There's a reason that Vi has 5 stars on Medicare.gov. They're a very good choice for a nursing home. So what are the costs? This is where you can see where that 5 stars costs you. Vi is a very exclusive nursing home that charges a one-time entry fee plus a monthly charge. The cost depends on the type of care and floor plan. There's 3 types of one-time fee. There's a 0% back. It's the least expensive, but no money back when the resident passes, but it leads to a lower monthly fee. There's 50% back. It's more expensive, but your benefactors will receive 50% of the entry fee when you pass. And there's 90% back. It's the most expensive, but benefactors will receive 90% of the entry fee when you pass. The crazy thing about that is that one-time fee for the 90% is about $1 million to $1.5 million up front to start living. And then it's still, depending on the floor plan, it can be between $4,500 and $9,000 a month to live there. So it's definitely a very, very exclusive nursing home to live in. The bad. A citation in 2021 because of infection control. It was related to COVID. They were fined about $600. They were fined exactly $600, and they have had no other citations since, and they have no other citations other than that. Insane cost of entry, and the average cost per month is not that good. While Vi will help all residents to attend religious practices, they're not a religious business, so they don't put on their own religious ceremonies. They've got nothing to do with any church or anything like that. So that's all up to the residents, which can be good, but it can also be bad for residents that are looking for that. So how does Vi stick to the eat-in alternative? VI does a good job moving towards the eat-in alternative by providing residents with many choices for all parts of their lives. Of the 10 principles, their weakest is spontaneity. VI seem to be very structured, so residents, while they can create spontaneous activities for themselves, it's not really VI creating that spontaneous environment for them. They just give them the ability to choose, but not really creating it. And that's just off my short time with them. Residents decided on a new menu and movie room, which they're able to design themselves, creating an activity to help some residents thrive. So that's one good thing that they did to move towards that eat-in alternative. So, biblical worldview. Proverbs 22:9. Whoever has a bountiful eye will be blessed, for he shares his bread with the poor. While VI is doing the good works by helping the elderly, it comes at a considerable cost. You can tell that they definitely have a for-profit model, which isn't bad for a company, but they're definitely not trying to move towards some kind of biblical worldview. Medicare won't cover the one-time entry fee, so not all Medicare patients will be able to come to VI, even though they're Medicare certified. And while VI does work with the community and charities, they do not have any systems in place to help patients who are unable to afford their one-time fee. So, it's very structured towards you have to have the money to join VI. These are my sources, and thank you so much. Have a great night.